Welcome back to Hometown Healthcare, where we are interested in innovations and perspectives in community healthcare. I'm Charlie Barnes IV, CEO of Barnes Healthcare Services, also known as Barnes Drugstore, in my hometown, Valdosta, Georgia, which is where our corporate office is, and we've been around for 111 years. Today, I wanted to talk a little bit about high level, the money, what we're spending in healthcare. So a lot of people may not think about this, or if they did, their heads would spin a little bit. So do you think you know how much we spend as a country, the United States of America, in healthcare every year? The last number that I looked at, and I'd have to check to have the right date on this, but I think this might be 2018, it was $3.5 trillion total spend, not just Medicare, not just Medicare and Medicaid, but total spend in healthcare, $3.5 trillion. What I've seen in different studies from entities such as the Centers of Disease Control, the CDC, the National Institutes of Health, is that out of that $3.5 trillion, 75 to 80% of that is chronic disease. So, chronic disease, what is that? Diabetes, even cancer, neurological diseases. So basically anything that you keep for a long time, that you're not going in an acute way, like going to the hospital in an acute state and then coming out and you're good. You're staying in that state. COPD, chronic heart failure. Those are chronic diseases. That's 75 to 80% of our spend. These same entities, government entities and others, say that 75 to 80%, maybe more, of that is preventable or reversible, meaning those diseases either didn't have to happen when they did, or they're reversible even now, where they are today and what is going on in those disease states. And that is phenomenal. So if you can do the math on that, that's close to $2 trillion. $2 trillion that we could take out of the healthcare system. So who's going to get their act together and figure out how to get our country healthier? How to get our people healthier, our communities healthier. And that's what we're here to do. I see that globally as what we do as an organization is we are trying to identify ways to move people into a better state of health, to get them better, to reduce going to the hospital, to reduce going into skilled nursing facilities or even assisted living facilities. Stay at home where you're going to have a better quality of life, where you're going to live longer. I think we all know once you go into a home, let's say a senior living home, life goes down quickly. Our seniors tend to lose purpose, and that purpose and life and that drive and that brings them down. So again, back to the point, those dollars are astronomical, and we're talking about lives, we're talking about people, we're talking about just how they live every single day. It's not necessary in a lot of cases. There's a lot of opportunity to move that meter, and we can do it as a country. We can do it as a healthcare entity here in Georgia and Florida. I think home care providers are the best positioned because they are seeing patients on a more regular basis, especially pharmacies in the mix of that. Others as well, working with primary care physicians, can really help move people forward. It takes root cause, finding the root cause to problems and removing those barriers. You hear social determinants of health a lot out there. How do we remove those barriers? But I'll leave you with this one thought. So today, everyone's thinking about COVID-19. What you don't hear the experts talking much about, very little, I've seen very little, but very little about, is improving your immunity or improving your health. Everyone's got the COVID-15, COVID-20, 30, 40, I don't even know. Well, that's making you sicker. That's taking you down the wrong pathway and giving you higher risk of getting COVID-19 or a bad outcome with it. Whereas you increase your immunity and focus on that, you're probably not even going to feel it if you get it or even know it. And so if you want to, as far as value time invested, if you're concerned about what's going on with illnesses out there, germs, sicknesses, work on yourself. The best thing you can do. We have to take control of our own health. With that, thank you again for joining me, and look forward to speaking to you again. Take care.